Good morning, everyone, and welcome to the 19th National Minority Quality Forum Health Leadership Summit that we do in partnership with the Congressional Black Caucus Health Braintrust. It has been 19 years, can you imagine that? 19 years that we have come together. I want to welcome old friends and new friends, and today, over the next couple of days, we'll share a lot of important information. One of the things I've learned over the last 19 years when we got started, we used to talk about health disparities and we'd enumerate all of the different health disparities in cancer, and diabetes, and asthma, and sickle cell, et cetera. And we used to say to ourselves, God, we'd like to move forward. We'd like to do more than just enumerate and list. What can we do to really begin to solve those problems? Now I'm happy to say those problems we're starting to really work on with deep collaborations. And one of the things that I've learned over the last 19 years is that it takes a village. We have to collaborate together. And we've brought together a lot of different friends to help us do that. And what you're going to learn today is a lot of the work that the National Minority Quality Forum has been doing, but we've been doing that work with you, with all kinds of partners, partners in organized medicine, and community-based physicians, and patient advocacy organizations, and members of Congress, and the executive branch, everyone working together to solve a common problem. And what we've learned in terms of solving that problem, it's really all about mitigating patient risk. How do we help each individual who come into the American healthcare system lower their risk for hospitalizations, ER visits, disability, mortality? And it doesn't care what color, creed, political persuasion, sexual orientation, none of that matters when you come into the American healthcare system. And that's what we're going to talk about today and over the next couple of days, is to introduce you to those who are new to us, the work we've been doing to reinforce our collaboration with others. And I'm pleased right now to introduce a great partner, Congresswoman Robin Kelly from the 2nd Congressional District in Illinois. We could not do this work without her. She's been an incredible partner over the last years, and we look forward to continuing and deepening that collaboration. So now I'd like to turn it over to Congresswoman Kelly.
Good morning, everyone, and thank you, Dr. Puckrein. I always look forward in joining you in these annual leadership summits. And I just want to thank you for all the work you've been doing with the National Minority Quality Forum, and congratulations on 19 years. That is absolutely phenomenal. As Vice Chair of the Energy and Commerce Committee, a member of the Subcommittee on Health, and as Chair of the Congressional Black Caucus Braintrust, I want to thank you for hosting these important conversations and forums. Throughout this past year, more people were exposed to a reality that we have known for a long time, that healthcare access in this country is not equal, and that too often people of color and minorities are the ones left behind. COVID-19 only highlighted these disparities, and so it is my hope that if one good thing comes out of this pandemic, it is a renewed urgent focus on attacking health disparities and bringing top-level health care to everyone, regardless, as you said, of race, ethnicity, religion, gender, or socioeconomic status. I will be joining you all for several events throughout the summit, and I look forward to sharing more about my work in Congress to address health disparities, specifically addressing the maternal mortality rate, increasing telehealth services, and diversifying clinical trials and the healthcare workforce. I know just how much work you all do to ensure that people around the country have access to quality healthcare that they deserve. Thank you so much again for all of your hard work. I look forward to learning more from you, all of you, and the experts that you have invited to participate this week. Thank you so much.
Thank you so much, Congresswoman Kelly. It is now my great pleasure to introduce to you a longstanding partner of the National Minority Quality Forum, Dr. Susan Bailey from the American Medical Association. We really appreciate their support and collaboration over the years.
Oh, thank you so much. Good morning, everyone. We are really proud to once again sponsor this leadership forum, and we thank you for the opportunity to join you for today's discussions about ending disparities in healthcare. COVID-19 has been a painful reminder of how important this work is and how inequities that are systemic to healthcare and society can result in dramatically different outcomes for people and for communities. Like you, the AMA is committed to this work, not only by centering our strategic priorities and advocacy around the health equity principles we share, but also by working externally through partnerships to lever our combined strength in changing a health system that disadvantages so many. We've laid the groundwork for this effort with the creation of the AMA's Center for Health Equity, which will soon release its framework for advancing equity through advocacy, partnership, improved physician training, and action. Our vision is a system where all people have access to the care they need, where tools and resources are equitable, where we work to identify and eliminate common barriers to care, where we root out racism and discrimination in all forms, and where all people and all communities have the power, the information, and the opportunities to achieve their best health. This is an ambitious goal, but I know there's an army of us working toward it, and that through much hard work, through the building and nurturing of alliances, we can create a health system and a society that treats all people equitably and with respect. We have a lot of work ahead of us, but nothing we do as physicians and as leaders in medicine will probably ever matter as much. Thank you.
Thank you so much, Dr. Bailey. It's now my great honor to introduce a longstanding friend. We've served on boards together back in the day when equity and inequality were not in fashion the way they are today. She's been on the front line making deep changes in American healthcare. And one of the things I always appreciate about her work is that people don't know how much she's done to reshape American healthcare, to make sure that everyone that comes into the healthcare system gets optimum care. So it's my great pleasure to introduce you to those who don't know her, and for those you do, to welcome Dr. Elena Rios, who's president of the Hispanic Medical Association.
Thanks, Gary. And it's an honor to be here with our esteemed colleagues. Thank you very much, Congresswoman and Dr. Bailey. I think for the National Hispanic Medical Association, we've realized over the 25 years that we've been around that how important it is to increase our next generation of leaders by mentoring and leadership development. And I think that COVID-19 has shown all of us how important our families are, and that we have to take care of our families and pass on our legacies. And I think what's been most important for us in building the National Hispanic Medical Association, along with Gary and all the friends here in this meeting, is that we have shown how important it is to pass on our culture, language, very, very much our traditions and values. And that despite the disparities that we exist, that we have gone through, and the racist and discrimination that has really been shown more to the mainstream than anybody, that we know we have to help each other become better at having quality lifestyles. And that means changing our behaviors, and especially with COVID-19, having the encouraging programs and again, volunteers to increase the vaccinations in our communities. And I think that's the most important message that I would say that we've learned, is that we have to start working together on the vaccination drives that we're all working on. For the Hispanic community, NHMA started Vaccinate for All a campaign that we really wanted to showcase again, that it's for all families, all members of the family. And we are working with all the other Latino and African American, Native American, Asian groups through the Alliance for Multicultural Physicians, and also with the Caucus and with all our partners to make sure that we all do our part in getting everybody vaccinated. The other thing I'll just say is that we do have a monthly webinar series. This Wednesday, we're actually highlighting the work of Black and Latino doctors and working with the NMA. It's Wednesday night at 7, just before President Biden addresses Congress. But if anyone's interested in joining our Vaccinate for All or our monthly webinar series, which is the last Wednesday of the month, please go to our website, which is nhmamd.org. And just a special message to everyone about how we all, just echoing what everyone has said, that we do need to continue collaboration. And we're looking for younger influencers through social media. We're looking for the older, wise people in our communities to join all of us in all of our activities, whether it's the COVID-19 or as we move further along, to continue to tell our stories about how important our leadership is. So thank you very much.
Thank you so much, Dr. Rios. We always enjoy working and collaborating with you. It is with some sadness that I have to say that Dr. Winston Wong, who we've worked with and I've known for many years, unfortunately had a cardiovascular event this week and will not be able to join us and represent the Asian and Pacific Islander physicians, and our thoughts and prayers go out to him for a speedy recovery. COVID has changed us a lot. We can't even begin to imagine how deep those changes are. What we see in terms of the excessive deaths and the hospitalizations in minority community remind us that still we have a long way to go before our healthcare system is operating at an optimal level for every patient that comes through the door. Over the next couple of days, as I've said, we'll begin to explore how we can make those changes to make sure that if ever we face another pandemic, we don't see the same kinds of disproportionate outcomes in our community. We want to make sure for certain, as Dr. Rios and others have said, that we get our community vaccinated. I also want to point out that there are therapeutics out there if you happen to get COVID that are underutilized, and a lot of people are suffering because we can't figure out how to distribute the doggone things. And what I'm reminded of is that those trials for those therapeutics were diverse. We talk a lot about diversity in clinical trials, and we did that, and somehow we forgot to get it to the patients. And so there are some other therapies out there that we need to take advantage of. And finally, one of the things that I really appreciate most about the summit is the 40 under 40 program, where each year we recognize 40 of the emerging leaders in healthcare in this country. And I always look at that and I can see the future in their eyes, and I feel confident that we're on the right path, that there's a whole new group of leaders on their way that will carry the mission. And hopefully as we pass the baton to them, we leave the world in a lot better place than what we find. So I ask you to think with us over the next couple of days, to join hands with us as we try to figure out the best way to provide great healthcare to every American. And as we come to the end of this summit, that we have a plan in action to go back into our communities to change these disparities and poor outcomes that we see. So I welcome everyone to this 19th summit, and we look forward to the conversation. Thank you so very much.